Greetings and welcome to the UHS training video regarding the eTang patient portal. This training video is designed to give UHS staff a better understanding of the patient portal from the client's perspective. This will enable staff to better advise patients on what their online options are when they're in clinic or when they talk to patients on the phone. Throughout the course of this video, we will cover the following topics. 1. How a patient can edit their demographic data. This includes their preferred email, phone number, and primary care provider. 2. We will talk about how they can fill out any incomplete compliance forms, such as the Statement of Financial Responsibility or Summary of Privacy Practices. Lastly, we will talk about how a patient can schedule an appointment online and how they can fill out any pre-appointment questionnaires before coming to clinic. What you see here is the eTang online patient portal landing page. The URL is etang.berkeley.edu. Patients will log in using their CalNet ID and passphrase. Upon successful login, they will get what you see here, and this is the landing page. To begin, we will begin by demoing how a patient can edit their demographic data online. This is a critical feature to understand as it will enable patients to set up their preferred email so that they can begin receiving UHS secure messages. When directing a patient to set their demographic information online, you'll want to point them in the direction of the Profiles link from the left-hand pane, seen here. Once selected, a patient will be given the opportunity to edit or set their email, mobile phone number, local address, and primary care provider, as well as other pieces of demographic information. To begin, the email address line here is how a patient can set their preferred email address. This is important so that they can begin receiving secure messages from UHS. The mobile phone line seen here is where a patient can update their mobile phone number as well as their mobile phone carrier. The mobile phone carrier needs to be set in addition to the mobile phone number. If it is not set, the patient will not be able to receive text message appointment reminders. Lastly, the patient can set a primary care provider by selecting the link shown here. Setting a primary care provider will grant them the ability to directly send a secure message to their primary care provider. As a note, staff should be aware that patients are only given the ability to set one primary care provider at any given time. Now, we will further break down their options when changing demographic information. For the email address, it's just a matter of hitting the edit button seen here. When a patient asks to be part of secure messaging, you will want to direct them to the Profiles section to set their preferred email. By selecting the edit button, a patient will be given the ability to set their current email address to something that is more useful or preferred for the patient. For them to set their email address, it's just a simple matter of going to the field seen here and setting it to a proper email address. Upon successful completion of their email address, they will hit the continue button and they will get a confirmation. After they select the confirm button, it will automatically update their email address seen here. To edit their phone number, it's just a matter of hitting the edit button seen here as well. It gives them the same kind of functionality and features that you've seen earlier with the email field. For this, it's just a matter of setting the phone number and then setting the mobile phone carrier seen here. The mobile phone carrier is a critical piece because if this is not set, they will not be able to receive appointment text reminders. Once selected, they can hit continue, and all they have to do is confirm, and that will automatically update their phone number seen here. The last major component of the profile section is to set the current primary care clinician. This will enable them to directly message a provider at UHS. Again, note that patients are only given the ability to select one primary care provider at any given time. When you direct a patient to set the current primary care provider, push them to the Profiles section and have them hit the Edit button under the Current Primary Care Clinician field. It will give them a listing of all of the primary care providers that we have at UHS, and for the patient, it's just a matter of selecting the radio button that is attached to the actual provider. Once set, it will give them a confirmation again, and once confirmed, it will automatically update their profile. Other bits of information that a patient is able to edit online includes their local address and local phone. Again, patients are given the ability to go here at any time and update any of these bits of information. This concludes our section regarding the profile section and how a patient can update their demographic information. We will now proceed to how a patient can fill out any incomplete compliance forms. As a note, staff should realize that patients will not have the ability to set appointments or create online appointments in the system unless they have filled out all of their compliance forms. They will actually get an error message saying you do not have compliance forms filled out. You are unable to set an appointment online. To direct a patient to fill out their compliance forms, it's just a matter of taking them to the Forms section on the left-hand side. By selecting Forms, it will list any incomplete forms that are required for the patient to be seen at UHS. If there are any incomplete forms, it'll be a clickable link that they can access. Once they read over the form, it's just a matter of hitting the I understand and submitting the form. The great thing is that this will automatically update their profile, and it will automatically update the patient's medical record in the open registration side of Point and Click. Once they are done, they can hit proceed, and that will take them back, verifying that they have completed the necessary compliance forms needed to be seen at the Tang Center. Now that this patient is compliant, we will go ahead and demo the appointment making process that a patient can do when they are on the eTang webpage. For a patient to schedule an online appointment, it's just a matter of hitting the appointments link on the left-hand side. Once they've selected that, they will get a couple of options on their screen. One, they will be able to schedule an appointment. Secondarily, they will be able to view their currently scheduled appointments. Additionally, patients should realize that with currently scheduled appointments, there will be a questionnaire link that they can click. By clicking this link, it will display the appointment questionnaire that corresponds with their visit at the Tang Center. Directing patients to fill these questionnaires out beforehand is a time-saving measure that will save them time and the front desk staff time as well. Once they are done with their questionnaire, it's just a matter of scrolling down and submitting the form. Once submitted, it will be uploaded into their chart note and be present for the provider when they show up for their visit at the Tang Center. To schedule a new appointment, a patient need only select the Schedule an Appointment button seen here. Once they've successfully selected that button, it will give them a couple of options in terms of what their online scheduling abilities are. The patient need only select the radio button that matches their personal needs. To schedule the appointment, it's just a matter of hitting the radio button and hitting continue. Every single one of the eTang pages has an overview page that is seen here. This gives them an idea of what the appointment types are and what they can expect from the visit. Appointments that cannot be scheduled online have the same functionality, only they will not be able to schedule the appointments online. They'll be able to get all the information needed, however, that they would need to know before scheduling the actual appointment. For example, if they needed to schedule a specialty appointment, it gives them all the pertinent information they need before making that specialty appointment. This information is critical for the patient because it gives them expectations on what they can and cannot do from the online scheduling feature that we have incorporated into Point and Click. For an appointment that can be scheduled, it will take them through what we call branching pages. In this instance, we will book a medical appointment and we will book a primary care visit. Once they are done with the overview, it's just a matter of selecting the appointment that they wish to have and proceeding. The branching pages give them a bevy of information in terms of what they can expect. This includes what forms need to be done, as well as branching pages explaining what to do in case of emergency or if they have any kind of issues with their health that require more urgent care. In this instance, if none of these are selectable or answerable, they can just hit no and proceed to make their appointment. When they get to the appointment reason page, there's a drop-down that corresponds with the reason codes that many staff have seen in the point-and-click system. They can select from the drop-down, or they can provide their reason for visit in the free text field seen here. Once they proceed, it gives them a space where they can edit or confirm their information. This includes the critical features of the email, local phone, and local address. If there are no changes, the patient can simply proceed. Additionally, we will always ask for a callback number when scheduling an appointment. This corresponds with the callback number that is affiliated with the appointment making in the open schedule system. Once they have successfully put in their callback number, an appointment listing page will be displayed, seen here. It will show them all of the available appointments, and to book their appointment, it's just a matter of selecting the appropriate schedulable appointment and hitting continue. Once they've selected the continue button, it's just a matter of hitting the book appointment field here to proceed. Once they've selected book, it will throw the appointment onto the schedule, and the patient can go about their normal routine. The last topic that I'd like to close on is the home page. By selecting the home page, this gives them a one-stop shop for all of their needs. Any kind of appointments that have forms awaiting their completion will always be displayed on their landing page seen here. Additionally, any secure messages that the patient has received will also be displayed on their landing page seen here. These links seen here provide direct access to different portions of the eTang online patient portal. For example, this link automatically directs to the appointment link seen here, and the messages link seen here will automatically link to the messages option shown here. In closing, the eTang online patient portal is now available for patients and should be heavily pushed, as it will make the clinical efficiency that much better and will allow patients unprecedented access to the Tang Center. Thank you.